Our agenda today and presenters are from Google Cloud's Public Sector Group. We have Parker Mills and Manny Fernandes, and they will share how Google is collaborating with local and state government agencies across the country on a broad range of initiatives, from data-driven mapping interventions as well as advancing digital equity using technology-based solutions that promote accessible and usable services in many areas of civic activity. And now I'll hand over to Parker and Manny.
Hi, everyone. Good afternoon. My name is Manny Fernandes. Thank you again for giving us your time this afternoon. I'd like to thank you on behalf of the Google Public Sector Cloud team to kind of acknowledge, that we appreciate again the opportunity to share with you a few of these use cases and stories where we're really using a technology as an enabler to help constituents and residents with challenges that they're facing today, where they don't have access to government in a physical form. As you know, all of us on this session in a digital setup right now, where that's not something that's accessible to everyone out there at any given point in time. So what we'd like to do today is kind of share a few of the stories with you. I basically serve a Northern California Bay Area public sector agencies. I work with counties and cities and departments. And then with me here today is also my peer, Parker. Parker, I'll let you introduce yourself.
Thank you, Manny. I support the state of Washington as well as Alaska from a Google Cloud perspective. And since joining the Google team a year ago, I've been working with Manny and a lot of our other colleagues to really take a deeper look at the technology and solutions that we offer to both the public as well as to our customers in state and local government, and how these solutions can be better used to identify, address, and make actions that reduce equitable service gaps in our communities. And just to get a high-level understanding before we dive into some of the more practical applications of our technology, I think it's really important that we start with our core mission. Unlike a lot of companies out there, we've had the same mission since our inception 22 years ago, which has been to organize the world's information and make it universally accessible and useful. And you guys may be familiar with a few of these tools today, which is how traditionally to our consumers, we've been able to live this mission out. And in Google Cloud, our goal is to bring the same culture of information to our customers and to help organizations in state and local government be able to provide that same level of access and that same connected experience with their constituency. Manny?
Yeah, so we'd like to share a few examples of where we think we're making a difference before we get into the actual use cases. So, as part of the cloud team, what we represent is really a set of individuals that are working with government agencies. They're working with, for example, cities and states on new projects out there that can help perhaps launch something that's quick, efficient. We're also helping with agencies, for example, that have what we would call legacy or antiquated systems, where they're having a lot of trouble applying some of the new mandates and policies that have come down, or, for example, using some what we call AI or ML-driven kind of automation to help better connect constituents with the agency, so they're not using a lot of legacy-based processes. And then last but not least, the goal really is once you have all that information gathered, whether it's gathered over a period of months or perhaps you've gathered over many years and decades, is how do we make that information accessible to you so you can make some sense out of it and use it for better planning? Because with what's going on today right now, it's we have to constantly react and respond based on continuous changes. And a few of those examples on the next slide, Parker, if you could just pull that up. These are some of the kind of projects that we've been doing lately. Obviously, remote engagement is one I think that probably all of you are very familiar with. When people had to leave last year and abruptly go home, a lot of folks that didn't have laptops had challenges with remote engagement. We've helped solve that in some ways with tools like Google Meet. We've also worked with agencies out there right now For example, public health agencies, state agencies with unemployment, welfare to work programs, 311 programs, where we're launching these AI-driven contact centers, where contact centers that perhaps only had 10 or 20 people prior to the pandemic now are getting hundreds of calls. It's just like this burden at the front door where citizens are calling in desperately for help and aren't able to reach anyone out there. So our contact center AI has these human-driven kind of assistants or virtual assistants that can pick up the call, answer kind of common questions, send them links to information, and improve that constituent experience. And then another area that I think we'll cover today, on the same slide, by the way, Parker, just real quick back on the last one, is when you have all these different areas that you're serving and you've gathered the data, we'd like to discuss today on how we can pull that information through our analytics kind of platform and make sense out of it so you can quickly respond to them in a COVID-19 kind of timeline. Next one, Paco. And I'll after this, we'll try to jump into the actual specifics. So in terms of impact to stakeholders, what we are seeing is from a citizen point of view, due to the job loss, a lot of individuals are coming up to agencies trying to get help out there. Some aren't able to get through, and some kind of get into a queue that get a response back several months or weeks later in some cases. So getting access to these portals or getting access to call centers over voice call are kind of slowly failing is what we've been observing. And so we'll try to talk about use cases where we've done certain things where in a few weeks you're able to address that. Also talk about how we are bridging the gap with not just the digital divide, but with constituents that may perhaps don't speak English, right? How do you serve them? How do you use technology to bridge that gap? And then from an agency perspective, we'll talk about how these existing legacy systems that they have are overwhelmed because they weren't designed to handle this kind of load, right? I mean, in the old kind of paradigm, they had a few folks that would perhaps data entry forms that came in slowly. Now everyone's just jamming it in. And so these systems are overwhelmed, they're crashing, they're having issues. And with all these new policies that are coming down, like for example, after today, there'll be new policies that come down that need to be implemented with benefit programs. How do you do it in a way that's efficient and quick enough that you can respond to your constituents in a timely manner? So we'll cover these use cases today. And the hope is, some of it's useful to you. And if nothing else, maybe educational on how you could do this using our technology or perhaps existing technologies that you may have. So with that, Park, I'll pass it back on to you to kind of cover the three areas or the focus areas for us.
Thank you. I appreciate that, Manny. And this is just a high-level rundown of the areas of focus for today. Just to begin with what I think is critical, digital participation and access. I used to have conversations with agencies pre-pandemic where we were trying to figure out how do we gain greater adoption of our digital tools? How do we make it so the communities that we need to serve, they don't have to wait to get on a bus and take a 90-minute round trip to go to a office and file an application or apply for a permit or engage with us. And while that has been very much so kind of put to the forefront with the pandemic, where the only form of access in many states where offices are closed is digital, it's actually had an adverse effect on a lot of communities where either lack of access to tools to engage with government agencies and services digitally or lack of proper broadband and internet access has created an inverse effect to where those citizens may actually prefer to engage with their government agencies in a more traditional fashion. And I took some of this information from a study that was done in my hometown of Seattle in 2018. And when we look at the data, and I'm sure there's very similar statistics in San Francisco, we're actually seeing that those who make under $50,000 a year, 19% of that citizen segment only have a mobile device as their means of access to the internet. And of those that make under $25,000 a year, they're 2.5 times more likely to rely on free or public access points for internet access. And again, this study was done pre-pandemic. So those population groups who only have the ability to access internet via public hotspots, with government agencies, in particular libraries, being closed down due to the pandemic, it's been incredibly more challenging for them to even gain that initial access point to engage with their government. And then we also see too, even those individuals that do have internet access, there's statistics that really show that that experience is not as great in those lower income segments due to the quality of the broadband access as well. And then we're also seeing further statistics around what types of groups are affected by only having access to cell phones. And without reading through everything, the net of what we see is these groups are more likely to be affected, are diversified communities. And if we don't look at how technology has been architected and how our systems are created to serve every population and not just those that have access, that is going to be our biggest key to encourage and gain greater digital participation and ensuring that we're meeting our citizen segments wherever they're at across any communication or engagement channel that we offer. So this is something that we've seen some government agencies do in the state of Washington, where I'm from. The governor very recently rolled out a plan to purchase 40,000 devices and provide them out to students. We've seen other government agencies, including the federal government in the past, take programs like this, where we're essentially able to take devices that used to be at a minimum $1,000 per laptop. It's gotten so inexpensive now to purchase and provide endpoint devices to citizens that we're seeing a lot of government agencies either do loaner programs or even lock down these services to only access specific government services as well as certain controlled browser experiences. And even once we provide that access, there's still the usability piece. So we've actually recommended and had conversations with agencies around building in a quick user interface that does a walkthrough or teaches that individual in the language of their choice how to actually use, apply for, and get services on that endpoint device. And another thing, just as a general statement at Google, we also do provide nationwide digital skills coaching. So myself and thousands of other Googlers at least once a week, we'll hop on and we'll actually walk somebody through how to use a service like Gmail or use something like Google Meet and help them make that pivot where they may previously have never had a need for video conferencing, but they may want to talk to their grandchildren for Christmas. So we've also seen a massive swath of private sector intervention as well to help encourage greater use across all of our communities. And to give a bit more of a finite example, in the very beginning stages of the pandemic, New York Department of Labor realized that they did not have a mobile application that was able to cleanly be used on any mobile device. And also it kept on crashing over and over again. So a large segment of the population that the Department of Labor was trying to serve didn't even have the ability to access and apply for those benefits. So we came in and we just stripped everything back down to the simplest possible approach and said, how do we make it so easy that somebody that's never used a mobile application before could use? Once they get access to that website, how do we make this as frictionless as possible? So we were able to build in a very simple walkthrough with some of the key prompts that you may be able to see. I know it's a little fuzzy on the screen to help facilitate and essentially walk somebody through that process. And we were able to do this within a 3-week window. And I think this is a good example of once somebody does have access, once they do have a device, how do we really make it easy for them? And how do we ensure that they're able to do this in a self-service fashion without the complexity and need to potentially wait in long call queues in order to actually file or get an answer about their application? And then next too, once we operate under that assumption of access, how do we ensure that our communication and our tools that facilitate that communication are inclusive? And that could be whether it be from a language perspective or whether it be from groups that may be deaf, mute, or blind. And I think that's really important when we talk about the continuum of language difficulties. Somebody that doesn't speak English as their primary language may have a challenge over a poor cell connection, speaking to a customer service agent who's assisting them as they try to get their supplemental nutrition benefits. So it isn't just for supporting people who only speak a certain language. It's about serving every potential aspect and population segment that could have a challenge with the way that our agencies are communicating with them. And I know this was mentioned very early in the call, but a good way to kind of demo this live is to click the captions piece on Google Meet. And what we've seen a lot of agencies do is if there's a challenge communicating with somebody or they need to schedule a call back, they'll send out a Google Meet link. They'll turn live captions on. So that conversation's being transcribed on the screen in front of them. So it has a really profound impact on elderly and vulnerable communities, as well as people that may not speak English as their primary language or English at all. And that's more of active communication. How do we help facilitate that and reduce those communication barriers in an active fashion? But sometimes we see a lot of people that just need to get information. They know how to get to an agency website, but they aren't able to get the content and they're not able to get their questions answered without having to make that phone call because that information isn't available in the language of their choice. I won't go through the video now. I'll send this presentation out. So if you're interested, feel free to click that hyperlink. But we're able to work with the state of Hawaii, who has a large tribal language requirement, to translate all of their agency documentation into 80 different languages and present those out to the public. So whenever a constituent needed that data and that information, they were able to quickly and easily gain access to it in more of a passive fashion.
Yeah, Parker,
Manny, I'll pass it over to you to talk about San Jose.
Yeah, that's great. So this is a project that we recently embarked on. It was about mid last year where we engaged with the leadership out there that was really interested in making sure that their constituents that didn't speak English, primarily in Spanish and Vietnamese and Chinese, were able to better engage with the city. And so we worked with them to create a translation project where they were able to fine-tune specific words. For example, in Vietnamese, there's a north and a south kind of dialect, which was split up. So we trained those models. And then as an example, what we did was we hooked that directly into their website so that all the content that they had within that service was then auto-translated on the fly. So that it just made engagement kind of easy. So here's an example of what that website looks like. And so if you wanted to go access that content in Vietnamese or in Spanish, you were able to call in using the voice or the virtual assistant system that they have. When you dial 311, you get the choice to then speak to that virtual assistant and engage with them to, for example, pick up a bulky item that's been left out there that makes the neighborhood look bad, or an abandoned vehicle that's a safety hazard down there. The outcomes of that particular exercise that they noticed was that not only does it make kind of the neighborhood better, it kind of really leads towards equity, can also help towards safety issues like potholes and so on. But most importantly, there are other kind of use cases that this can be applied towards with our elders or with other folks that are out there that need help. So they are looking to now expand this out to a whole different set of use cases today. And I think, Parker, the next one we were going to cover was around employment, right? Using the virtual agent as an example.
Yeah, correct. So thank you for that, Manny. And this goes back to more of that active communication piece. So we've covered how to make information accessible, and then how do we have real-time conversations and make them more valuable by ensuring that the communication styles match. There's also the other component here of with our agencies being slammed with inquiries and with things like, for example, vaccine inquiries and vaccine hotlines having limited capacity today. We're seeing in my home state hour-long wait times to get general responses about the vaccine, which with how rapidly things change, you can imagine citizens have new questions every day. So how do we keep up with that, and how do we rapidly meet citizen needs as they come up? A good example being in the state of Illinois, we were able to make a virtual agent that leverages our conversational AI and our natural language processing. And within the first 2 weeks, we were able to handle 3.2 million inquiries via our chatbot, which you can see a little picture of that on the right. And then we were actually able to program intelligent conversational flows via a voice agent as well. So a citizen could theoretically get their claim information answered via the web on a chatbot if they didn't feel like their question was difficult or challenging enough to call in and they just needed data. Or we were able to assist them with a virtual agent that we trained to actually give critical data, such as when a claim had been filed, when a claim would be available to them, and also more specific information on them as a claimant. And I'll give you a quick example too of another implementation we did in Colorado. We also facilitated this in multilingual as well. And I think a big key here is we're able to hit every possible channel for communication. It could be on the web in a chatbot, it could be over the phone, it could be static data or information on the web, or an actual one-on-one conversation with a contact center or customer service person. So we're giving multiple options to citizens that have different preferences and different needs in how to engage. Another quick piece on this too that I think is just really important to mention is a big core in this is our conversational AI and our speech-to-speech. I had a conversation with a utility in Colorado that told me at the outbreak of the pandemic, they were having so many challenges with interpreter capacity that their call center agents actually pulled this up and started using this on the fly to live translate with people. And I'll let you guys play with this afterwards, but just to quickly show how real time this is, once you click it off, it immediately will translate into that language or into that additional language piece as well. In that service, as well as Google Meet, these are both things that are free and available to the public. And our goal at the beginning of the pandemic was to have tools that we built to facilitate ease of use and communication and provide them out to the broadest population segment as possible to do our part and see if we could help to limit the concerns and the fear that come with COVID-19. It's just a bit further on the some of the other applications we see with virtual agents, enabling multilingual assistance so we can curb capacity for or help to supplement potentially curb capacity for interpreters. And then also the next piece that I'll be speaking about is document upload. We still have all these physical channels that people use to engage with us. How do we also help to make that process for people that are still sending in their applications or may not have any access to a mobile device? How do we make that to be an easy experience? And specifically, how do we help that experience be equal for our citizens that may not speak English as a first language as it is for our English-speaking citizens? This is kind of a journey of an application. And one thing I think is critical to point out, I interviewed a few of the agencies in Washington as well as in some other states, and we found that a lot of organizations, if a document had been received that wasn't in English, there would be an additional step for them to get their claim processed. So we actually were able to work with Pennsylvania, New York, and Arizona to use a AI system that will automatically extract and map that information from a document, whether it be in English, Spanish, or another language, and put like really high confidence scores that the information that was put in was correct. If it didn't meet that score, we put it aside for additional vetting. But what we found was significant percentages of decreased time for submission and approval of an application. And while it did especially help those that were not submitting their applications in English, it resulted in shorter processing times for all citizens. And we can bring that same type of functionality to a virtual agent over the phone or to a web chat piece as well, especially for our agencies that we see be hit with very high call wait times and very high call back periods for non-English speaking citizens who, if they had the option to engage in that digital fashion, they may be willing to. And Manny, I'll let you talk a bit about some of the other more creative ways that we've helped to facilitate traditional government services during the pandemic.
Yeah. So this is an example of where we're using this right now with a few agencies in the Bay Area with foster kids. As an example, we've found ways to build a closer kind of working relationships with these kids and their foster parents and the caseworkers. In kind of the old world, you'd have caseworkers that would drive and go out there and and engage and kind of care for the health of that child, right? Now that getting around is difficult with kind of the pandemic and all that. Going digital has become one of the more viable ways that we found. It's being adopted everywhere, where mobile devices or smart devices are being used to engage between caseworkers and parents and children. They can check in on them more often. They can perform these remote visits with them when needed. If a therapist needs to work with that particular child or follow up with the parent, they're able to also use this medium to connect with them. The reason why I was kind of walking you through that journey is we also see this being now used for elderly, and disabled individuals out there, where it's difficult and challenging for them to engage with someone. So using a digital medium really helps them connect with someone, speak to them, get the help that they're looking for, or maybe even connect with their health professionals out there. And then in other cases, we're also seeing it being used for benefit programs. So if I am Manny and I'm applying for a particular benefit, I can use that for an interview to get that kind of that validation done, prove I really am who I am, show them my identification and so on. But then most importantly, at the end of that whole kind of journey, we build a case around that and then provide kind of the tools necessary for caseworkers and administrators to provide a more meaningful and kind of a platform for a better experience and a journey through that process. So we think that technologies like this can help you out. And another example in this scenario is a virtual career center. Again, prior to the pandemic, people will go into the county or the city virtual career center or the library. They'd get help. They'd fill out a paper form. Now that we've gone all digital, I've actually worked with the county in the Bay Area where they bought some low-cost Chrome devices and actually rolled out, or in the process in the Bay Area of rolling out a virtual career center where the caseworker is actually helping this individual transition from the existing field into a new field. They've never used email. They don't have a resume. So there's a whole journey associated with how they get them online with that low-cost device. They have an email account on Gmail. Give them Meet so they can connect with their counselors and get the help to build a resume. And this is really helping bridging that gap during these times, right? Because they can't go anywhere for help. So the only help they can get is digitally or virtually with the help of a caseworker or a counselor and so on. So the virtual career center was rolled out in a few counties and states right now, but it's one where it's gaining a lot more traction with the unemployment and also helping kind of bridge those other gaps out there.
Yeah, and one thing I'll add there too, Manny, I'm on the advisory committee of a local technical college here, and I was talking to the president a few weeks ago, and he said one of the biggest challenges they've seen is the inverse group of that first time hire, that individual that's first going to get into the workforce. In addition to staggeringly low re-enrollment rates, they're also seeing a significant percentage of their students not get hired out of their final semester of college because there isn't the ability to have the traditional career fair or job pairing interviews that they had in the past. And I know I'm speaking out of personal experience, I got my first job out of college at a career fair. So it's another way of leveraging some of these tools and systems to facilitate some of those same experiences across different population segments based on what the need is.
And Parker, one more thing I'd add to that is really, I forgot to mention, this is very important for public-private partnership, is a virtual career center like this also provides employers the opportunity to come out here and post their jobs, right? Whether they're looking to hire people, that of a particular skill set. It provides individuals with maybe special needs to find kind of the fit for that job. So it really helps bridge that gap right now, because right now everything being so disconnected is making it difficult for employees to find jobs and for employers to find candidates. So the idea is that this virtual career center bridges the two. And then one last one I'm going to leave you with on this particular thread is around what we've heard from other agencies. For example, I'm working with another agency where they have engagement between the caseworker and elderly staff. And at the end of that call, what they want to do is gain kind of feedback from that individual on the experience that they had. So they have a post-call survey. And what we did was built a voice-based system where at the end of that call, we get transferred to the system and it would ask them 5 to 6 questions. And the system would take those questions in different languages or answers in different languages, in Vietnamese, Russian, Spanish, and so on. But what that did was it gave the organization an idea of where their services needed to be improved, services that they weren't even providing, and then KPIs that were needed to go get funding so that community-based organizations and departmental organizations understood kind of the volume that they were dealing with. Because right now it's on paper and it's very difficult to track, so it's difficult to get those metrics. So we're also enabling surveys that can help drive kind of the sentiment of those individuals out there today. And Parker, I'm going to pass it back on to you, I think, after this slide.
Awesome. Thank you, Manny. And we're hitting the tail end here. I thought it would be very important to talk a bit about getting meaningful data to support some of these conversations and assumptions that we've been having. I put a couple of ideas here. I know this will be different from everybody's perspective based on what you guys have seen firsthand. But a common theme I've had when talking with organizations is we have some surveys, we have some ideas based on some of the objective metrics that we have on where our service gaps are to different communities, but we have trouble surfacing real, raw, recent data to support those assumptions and show if there's potential bias in the creation of a tool. And also show if our assumptions are potentially incorrect and that there's other population segments that we need to be reshifting our focus towards. And then most importantly, once we have this data, once we know where our service gaps are, what is the action that we can then take to address that piece? And typically, this is just to kind of show a more traditional way of looking at sentiment and social analytics, whether it be from surveys, and Gallup polls, and also reputation scores across different digital media properties. We've typically seen these have a few shortcomings: selection bias, response bias, and also recency bias from it being a snapshot or point in time study. Again, many surveys and things that we looked at in 2018, right after COVID in 2020, are probably a lot different and have had different effects. So how do we use all of the data that we have today within agencies? How do we use information that's been provided out to the public, whether it be CDC reports, census data, employment data that our states provide us, and then add in digital behavior, digital data, and other data sources to actually get a real-time pulse on what is happening in our communities and how we redirect our services? And I'll give just a real example of what we were able to do for state of California. I'll talk about what we're showing here and then how we actually were able to aggregate this data. We're able to get a good look at the effects of COVID-19 on health equity. How are the least advantaged likely to be affected by COVID? And what is the sentiment in these areas? And the lens we were looking at here is how do we see what communities have been most adversely impacted by COVID-19, and then also gauge their willingness to receive a vaccine so we can determine how we need to best target those communities and ensure that they are comfortable and confident getting vaccinated. This has incredible impacts when it comes to elderly and disabled communities as well, who are first up to get the vaccine and who we need to ensure are comfortable and able and have the information and the data they need in order to feel confident getting vaccinated. And I'll talk a bit about how we're able to aggregate this data in the next couple slides here. And so actually, we began with California before looking at COVID equity. We looked generally just on what digital engagement and behavior was. So we're able to get very anonymized but aggregate information on what different segments of the community are searching for. So good example being day before shelter in place in Washington state, we had the largest increase in searches in visits to public parks in the history of the state. That gives us some really interesting information around where people are looking and going. So if we can apply that same methodology to vaccine complications, right? How often are people looking at a general level on complications with the vaccine? Another thing this type of information gives us is it gives us information on where there's low digital reach and where there's what we refer to as white space or lack of activity. So we know where the communities are that we may need to get more creative in our outreach and advertising efforts for. That may be newspaper or traditional advertising. We've also seen with fighting wildfires in the state of Washington, the state has allocated street teams to actually go door to door and encourage private landowners to curb activities that may start a wildfire, but at least tell us where our low digital engagement is and where we need to be more proactive on the street. And yeah, this is just a more firm look at how the behavior or the search patterns give us an informed view of what that behavior is, so we know where to mobilize our services. And this is back going to April, right? But pivot this to what we're seeing now for vaccine searches. We just are getting news that there's about to be another stimulus put in place that has many impacts on the way state services will be provided to citizens. What is the reaction to that? People are naturally going to be curious about how to get those services. How do we quantify what that interest and activity is so we can make actions from there? And that's where some of the physical information comes in, the information that you guys as agencies already have, but then also actual objective physical data. So like one thing the state of California also did was they looked at Bluetooth pings, and they were able to actually use anonymized mobile device locations or just general where are mobile, and correlate that with where visits to different web pages are, where visits to different services are, and then also look at things like, again, where the lack of digital is, where the lack of that of those Bluetooth pings are, and find a way to better target those communities and take that same information and better target action. So looking at those white space areas, looking at the socioeconomic makeup of those areas, and then seeing where we need to best deliver services. And this is kind of what we view as the holistic way to take the information that an agency has, pair it with public information that we're able to get, and then get a full pulse on the citizen group to find out where we should be directing our efforts and our services based on this information. And I'll do one quick real world example of this. And this is more around opioid prevention. During COVID-19, we saw massive spikes in fentanyl overdoses, and state of Arizona partnered with us to see if we could better figure out and preempt where these substance abuse outbreaks would occur, so we could better direct services to these areas, whether they be mental health counseling or whether it be more proactive prevention messaging. And we were able to do that by taking in that medical data that you see on the left, public data, and then the actual digital data. Are we seeing increases in searching for public health benefits in lieu of medical benefits that people may have lost due to being unemployed due to shelter-in-place orders during the pandemic? How do we actually quantify what that impact and effect has been and draw these correlations? That is what our aim is by taking in some of this data.
And Parker, I think there was one quick last example we were going to wrap this dashboard up with, taking a very specific area within, or example within the Bay Area on the next slide. I think, Parker?
Definitely, yeah. So, and I'll make a caveat there, Manny. So we're talking about more of that individual level, right? We're talking aggregate in the sense of where do we find our white space or where we need to better engage with non-digital participation communities. But on a one-to-one level, how do we identify what segments are having challenges with opioid prevention and abuse? How do we identify with this type of analytics and this technology where we may need to architect our tools differently because we're seeing that there's low use of our application or our platform in these areas, and then making steps from there. But what Manny's going to talk about is more of that geo component of, once we have some of this data, how do we actually map it out and then draw broader correlation amongst different districts in our communities to take action on? Manny?
And here's a quick example. Within San Francisco, we've been working with the Bay Area Quality Management District through one of our partners, where they've essentially been doing for the last 2 years block by block measurements of air quality. And initially, it was really focused on kind of greenhouse gases and other particulate matters that were causing health issues to residents. However, what is really interesting is earlier last year, as COVID was spreading, what they found out was because particulate matter was at like what was considered PM 2.5, it was thick enough where, large enough where it was proven that COVID could actually attach to the receptors, or those COVID receptors could attach to the air particulate matter and spread out. So this company that we were working with really kind of helped shine kind of the disparity in health impacts that are faced by many residents within the region. And so that platform and the information that we're now using from that is being used to make better decisions to protect the health of all Bay Area residents going forward. So what it does is it identifies pollution hotspots, and then they have these basically green cars that drive around the whole city. They map all that data down, and they know where there are certain hotspots within the city where there's unhealthy air, where you have a higher risk for exposure to COVID and other related things. And so what we could do is, just like we had the last slide where we're dealing with the opioid kind of epidemic, we can pull in air data, pull in digital data, pull in other data points in, and really provide kind of a dashboard for better decision making, whether it's for a policymaker or whether it's for a department, because there's only a finite number of resources. And the hope is that you can use those resources in the right places versus just sending them out in a lot of different directions, right? So I think that was kind of one of the last slides on that particular area. What we wanted to kind of leave you with was just feedback that these are what we call use cases with different agencies, government, nonprofit, and so on that we work with out there. Parker and I are committed to kind of engaging at a county level, city level, nonprofit level within the region to see how we can help bring that kind of technology to help the digital divide, help address equity-related initiatives and projects that are going on out there. And we'd like to continue that discussion, with Andrew and Carla at the Technology Council. Let us know if some of this resonated with you. I know there's going to be some open Q&A here. Ask us questions, see if some of this resonates with you, and if there are areas where we could help you out with. The thing I want to leave you with also is that these projects are not traditional multi-month projects. I mean, a lot of these projects were done in a matter of a few weeks. Like, we could stand up a contact center AI in like 3 to 4 weeks, and you have a virtual assistant that's actually answering maybe 300 missed calls a day and bringing about a level of engagement and keeping them informed, keeping people engaged on what the next action item is. It reduces anxiety. It helps them connect with health workers, case workers, and so on. Parker, I don't know if you wanted to add anything else to that, but thank you again for your time today.
Yeah, thank you, Manny. That's you stated it very well. One thing I'll say is every agency is different. There's no challenge or problem that is too small or too big. That's what we love to do is get creative on helping to solve the ever-changing dynamic needs that our agencies are faced with during COVID and will continue to have after COVID as well. And thank you guys for being available for the conversation and for listening to us yap for the last 45 minutes. We'll answer some questions now.
Thank you. Thank you so much, Manny and Parker, for joining us today. This was amazing. You've given us a lot to think about. If you have questions, please put them in the chat. That's the easiest way. We've got a lot of people on this call, which is great. And we'd like to, again, say thank you for joining us as we move into the questions. There's a lot of interest, Manny and Parker, first of all, in the one-on-one coaching that Google does in terms of lessons. And I believe, Parker, you put it in the chat, the website where people can go to find those one-on-one lessons. Is that correct? Grow.google?
Yes, indeed. Grow.google. There's a lot on that page because there's actual programs that you can sign up for that have somewhat of an application process. But then there's also and things like career certificates. But the coaching piece is what I was alluding to earlier. And those are, I think, just via calendar, you're able to sign up for those. So if you navigate over to free training, put in your city or your state, those will pop up some of those workshops.
You know, one other thing I'd also leave with is on this page, you can see, you know, Google, I want to say mid last year, launched a program to really help individuals kind of through a program where they can get certified. You don't have to be like a engineer to do this. There are some career certificates available out there that can, you know, help people into entry level kind of technology jobs, and, you know, kind of put you at least on the path towards it. We offer what's called a Google IT Support Professional Certificate. That information is also on this page. And it kind of gives you a few skills that, you know, may help people who are transitioning into a new kind of industry or want to get into IT, kind of, you know, use those resources that are out there. So we have, you know, put these out there, and you can go kind of through the process and learn more about it.
We had a question, and Jennifer also asked about captioning, which I'll respond to quickly. Give it a try yourself if you haven't already. Click turn on captions, and they are quite accurate, especially in this live setting, and it's exciting to see. We've got another question about you had the child welfare and aging support slide, Manny, that was a little earlier on, and you talked about the child welfare aspect more. Looks like Carmen is interested in a little bit more about how that can be applied to seniors and the aging arena.
Yeah, so it's interesting that the medium tends to generally be the same. And I think you are doing some of these things out there right now, right? Through the SF Tech Council, you offer these devices. What we've seen happen is in a slightly different mode where, for example, you know, my kids, they get a Chromebook from their school. It's a low-cost device. It's they get Gmail, and they connect with that with their teacher on a daily basis where they get help, right? So we're kind of using the same concept with the elderly, and where, say, for example, there's someone out there who has who needs a hearing aid, and they can switch on captions at the bottom so that, you know, they can read what the other individual is saying, and vice versa. So we're helping provide that connectivity back and forth. We're also using it for caseworkers. Say, for example, I need to check on 5 elderly individuals every day, and I have a set time. So it gives me an opportunity to say at 1 p.m., we will both dial into this particular meet room, and I will talk with you, and I'll share information. And if I need to walk you through the process of teaching you how to maybe go to a website and submit a form for a hot meal or for some other services around your health, I'll work through you. I'll work with you through that process. So they're using that as another medium. And on the back end, we've built some what I would call kind of basic case management systems that we can track that experience and then track that engagement, so they're able to better serve those individuals and they're not forgotten in some ways. Now, I don't know if there was a very specific question on that slide, but happy to address that too.
You know, we've got, let me see, about 7 more minutes of questions, and we've got a bunch more. Let's keep moving through. A lot of interest here. Al was wondering if there is a contrast when working with residents living in a rural versus urban environment, as well as with the respective government agencies in each. Do you notice differences?
I saw that question. I was curious if you could give a little bit more context as to the ask. Is it service delivery based on rural versus urban?
Al, do you want to unmute yourself?
Yeah, just looking for the button.
Okay.
It's not, maybe it's a bit on the service delivery side. It's more on the individual side. And, being able to, in terms of the digital divide, in terms of literacy, in terms of the types of services, in terms of quality of data at the government level.
Yeah, that's interesting. I'm going to put something in the chat that I stumbled on recently that the University of Wisconsin put together. It's a neighborhood atlas across the US where, like, just looking in Washington State, I'm noticing that the inputs that they have that basically create, like, for lack of a better term, like an equity score are significantly worse or red in this case in more rural communities. And one thing we found with recent events, like let's take something like wildfires, for example. We have partnerships with the largest cities and counties with their regional fire departments and their service groups that are able to rapidly assist and provide services where state government might have a bit of a lag in their reply. But a lot of these rural communities rely heavily on state government. We're also seeing that with public health response. Seattle and King County Department of Health have their own analytics, their own dashboarding, and they're providing a lot of their own services and information to the public, including their own contact centers for information. But a lot of the east side of the state in a lot of smaller communities are relying solely on the Department of Health to give information to them. So to your point, we see urban communities tend to have more support overall because there's larger funding and larger availability of resources through their city and county partners, whereas more underfunded, more adversely affected communities during COVID, especially rural communities, have less support from a base funding perspective, and B, as a result, less support across both local and state.
And from another initiative that I was working on with the transit reopening with a county down in South Bay, they were also using some of the data that we had collected with our mobility reports and connecting that with constituents that don't speak English to ensure that transit routes perhaps went to people who needed it the most versus just running the transit through all neighborhoods where people necessarily weren't using it, right? So efficiently rerouting kind of buses on schedules and getting help to those people out in non-urban areas.
Marie had asked if you are working with other organizations in the San Francisco currently on projects, and you've mentioned San Jose.
Yeah, so in the Bay Area, I am working with San Francisco's Human Services Agency. I do work with a few other departments around the city and the county that are under kind of the mayor's initiative, and then I support essentially Northern California from the south of the border all the way down to Santa Cruz and Santa Clara, and then the other big counties would be Alameda, Contra Costa, and Sacramento. So like the Virtual Career Center, I'm working on that with a county out east. There's translation now in 2 or 3 different counties within the Bay Area. The Contact Center AI is launched in a few areas. So we're kind of working with it continuously as these issues kind of pop up. Like we just recently spoke to a big health department that's now using it to outbound call for contact tracing, right? So instead of calling into the virtual agent calls you, does the contact tracing, but also helps you with scheduling. So if, for example, there was a list of 3,000 people and it was reprioritized to like the elderly, that system could call them out in that language and say, hey, on the 5th of February, please make time to be at this community-based organization to get your first immunization shot, and then remind them and schedule it. And so these systems are going beyond kind of public health departments into other areas too, whoever needs to help those constituents.